Thank you so much, Christine, and thanks for having us. I'm really excited to be able to present this work to everyone today. So I'm going to be talking today about a new app for the recognition of heavy menstrual bleeding in adolescents, and it's called WeThrive. So recognizing that there's a mixed audience today, I'm going to go into a little bit of the methodology behind how we made this app and why. I'll start by defining heavy menstrual bleeding and describing its impact on quality of life. I'll explain the challenge in assessing heavy menstrual bleeding in adolescents, although I'm sure many of you are already familiar with that. I'll describe to you how we validated a new tool called the Adolescent Menstrual Bleeding Questionnaire, or the aMBQ, that measures the impact of heavy menstrual bleeding on quality of life. And then I'm going to demonstrate for you our new app called WeThrive that hosts the aMBQ. I'll discuss the design, development, and implementation of mHealth apps in general for the researchers in the audience who may be interested. And I am happy to take questions at any time. So Christine has so graciously offered to monitor the chat for me. So any questions that come up, please just interrupt me and I'm happy to answer as we go. I will disclose that the research behind the validation of the aMBQ was funded by a mentored grant at the hospital where I work, the IWK. The development of WeThrive was funded by the Canadian Hemophilia Society Care Until Cure grant. And I have a personal disclosure that I have been a moderator for the Dutch Menarche online forum, for which I was provided with an honorarium, and I have invested that money back into the WeThrive app. I would also like to disclose that I am myself a proud Winnipegger, and so it's really exciting for me to be able to connect with people in Winnipeg. I am still a proud Jets fan, but I certainly don't miss the winters, so I hope everybody is staying warm. So first, to define heavy menstrual bleeding. Heavy menstrual bleeding is traditionally defined as menstrual blood loss more than 80 mils per cycle. It is thought to affect up to 37% of adolescents, but many researchers think that may actually be an underestimate given how hard it is to diagnose heavy menstrual bleeding. Heavy menstrual bleeding on its own is not a disease, but it could be a sign of an underlying disease, such as an inherited bleeding disorder like thrombophilia, or hemophilia, as well as other bleeding disorders such as von Willebrand's disease. There are other disorders as well that are not bleeding disorders that may be associated with heavy menstrual bleeding, such as endocrine disorders or thyroid dysfunction. And so in the medical community, I really like to define menstruation as a vital sign. We don't have a great way of measuring the amount of menstrual blood loss per cycle. And so as clinicians, we often rely on surrogate physical outcome measures that we can easily measure, such as a hemoglobin to look for anemia, or doing iron studies to look for ferritin. But these are not the best because, as you all know, a patient may have heavy menstrual bleeding without being iron deficient or anemic. And ideally, we'd like to make that diagnosis before they become iron deficient or anemic. We do have the PBAC, or the Pictorial Bleeding Assessment Chart, which is a way that adolescents and persons can track the number of menstrual products that they've used during their menstrual cycle in terms of their number and amount of saturation, as well as keep track of clots. And the total score on the PBAC can help you diagnose heavy menstrual bleeding, with a score of over 100 having a sensitivity and a specificity of over 80% for making the diagnosis, which is just our research fancy language of saying that we can use this tool to diagnose heavy menstrual bleeding with fairly good accuracy. We know that heavy menstrual bleeding has an impact on quality of life, and some of you may have experienced this. Over a quarter of adolescents have reported missing school because of heavy periods. Heavy periods or heavy menstrual bleeding can affect participation in sport and social activities. And it's not just an impact on quality of life, it's also that impact on physical health. So 12% of menstruators who have had heavy menstrual bleeding have been hospitalized for anemia in the past. 5% of those requiring ICU admission for resuscitation because of blood loss. So this is a serious concern. When we were looking at the impact of trying to better understand the impact of heavy periods on quality of life, we met with a focus group of 5 adolescents at our health center and asked them to write down ways in which heavy periods have affected their quality of life. And you can see here some quotes from this focus group. So some participants noted wearing a sweatshirt around their waist during their period, packing extra clothes to bring to school in case they bled through the clothes they were wearing. Some participants would even admit to skipping school because their uniform pants were beige. They weren't permitted to wear something else, and they feared the bleeding through their clothes and that being visible to others. There was also this interesting concept that come up about the cost of heavy menstrual bleeding, not just the cost of buying menstrual products, which we know is expensive on its own, but also the cost of leaking through clothes and leaking onto furniture and having to pay to replace couches and mattresses on their own accord. These participants also identified bullying as being an issue. So bullying because of the leaking of menstrual blood through their clothes. So this is just a small snapshot of how heavy periods can impact quality of life. And so as a clinician, I find that there are a number of challenges in assessing heavy periods in adolescents. I don't think we have great ways of asking this to teenagers, and it can be a sensitive topic. So not every teenager likes to talk about their periods and how many products they're using. They might find it upsetting or embarrassing. You know, we know that as part of the normal developmental stage of adolescence, that there's this really important need for privacy and concern for confidentiality. And so talking about these sensitive private issues with a healthcare provider can be upsetting and distressing for an adolescent. And what's interesting is that in families where with inherited bleeding disorders, such as hemophilia, there may be a lack of recognition of heavy menstrual bleeding because menstruators, as they grow up and have their first period, they may only have relatives in their family to compare their period to, and those relatives may actually have heavy periods and not realize it. So what's labeled as normal in that family that has an inherited bleeding disorder may not actually be normal menstrual bleeding. And so we sought out to develop the Adolescent Menstrual Bleeding Questionnaire, which was intended to measure the impact of heavy menstrual bleeding on adolescent quality of life. What we did is adapted the menstrual bleeding questionnaire, which was published for use in adults, and really adapted it to create the Adolescent Menstrual Bleeding Questionnaire. And so in short, we did this by adjusting some of the language to be more applicable to adolescents and adding a question that addressed bullying, as that was something that was identified as being important. We asked a focus group of 5 adolescents with heavy menstrual bleeding to review this new adapted menstrual bleeding questionnaire that we called the Adolescent Menstrual Bleeding Questionnaire, or aMBQ. And then we sought out to evaluate the tool's validity and reliability. We did this by enrolling 52 participants, 20 of those with heavy menstrual bleeding over a period of 3 years. We asked every participant to fill out the aMBQ, the PBAC, so that's the chart of the menstrual products, and the PEDS-QL, which is a generic measure of quality of life, at 2 time points, both at study entry and then again in 1 or 6 months, depending on whether they had heavy menstrual bleeding. We ended up enrolling over 50 participants with a mean age of just under 15 years. And what we found was those with heavy menstrual bleeding had significantly higher scores on the aMBQ than controls, which we would expect. We confirmed the validity of the aMBQ as it had a moderate correlation with scores on the PEDS-QL, showing the need for a disease-specific measure, but also a good correlation with the quality of life measures that are previously validated. In the group of controls, so patients that didn't have a prior diagnosis of heavy menstrual bleeding. We found there was reliable substantial test retest reliability, which basically just shows that if you administer the tool multiple occasions in someone whose period isn't changing, you can expect a similar result. What was exciting is that we found that a high score of greater than 30 on the aMBQ actually identified those with heavy menstrual bleeding with good discrimination and a specificity of 84%. So what that really means is that the aMBQ may be a way that we can identify adolescents with heavy menstrual bleeding. And for those of you who are interested in reading more about the statistics and the validation of this tool, I'm happy to say that it was recently published in November, and it's open access, so it's freely available to anyone who would like to read it. But like any research study, ours had limitations. And what we noticed was that less than half of controls completed their second set of questionnaires for the second time. So we had to re-recruit, and recruitment took a lot longer than we originally anticipated. And we really thought that part of that was probably due to it being a paper-based questionnaire, and that teenagers would lose the questionnaire, or they didn't want to carry it around with them, something like the PBAC that they had to keep with them for their entire period to try to track every day the number of products they use was cumbersome. It's also probably something that they want to keep private, and it's not something they would want, their parent to remind them about, for example. And then, shortly after this study, we had to learn to adapt our research execution within the hospital quickly to the COVID-19 pandemic, which made it even harder to hand out paper-based questionnaires. In fact, for months, we were restricted in doing that because there were to be no non-clinical face-to-face interactions with patients. And over time, we've learned that technology can assist adolescents in communicating their menstrual patterns and their health behaviors in general with health professionals, since they're comfortable engaging with the world through technology. And another limitation, as any researcher can attest to, is just the limitations of paper-based questionnaires in general. You end up with this stack of questionnaires this high, and you're manually entering all of the data by hand. And so after having done that, I thought, there must be a better way that we can research how heavy menstrual bleeding affects quality of life in adolescence. And so I started thinking about making an app. And so mHealth apps, or health-related apps, are not new in medicine, of course. There's an excellent systematic review that talks about the features of health apps that adolescents look for. And these include things like it being very visually appealing, easy to use, free, not too many features, no advertising, confidential and private. And so reading this got me thinking about what is out there that exists as a menstrual tracking app for adolescents, and what is it lacking? And so, as I'm sure many of you know, there are over 200 apps that are available for tracking menstruation. And these are just a few of them here. A few limitations to these. One is that the majority of them are designed and intended for adults to use. There was actually only one app that I could find that was designed for adolescents. And it actually included prediction of fertility and ovulation and fertility windows, which has been cautioned by the American Academy of Pediatrics, has cautioned families against recommending these apps for adolescents, given the false notion that tracking ovulation is sort of a good enough way to for contraception. And so we like to avoid using ovulation prediction as a means of contraception in adolescents because it's not reliable. And so apps that do that can sometimes give that false reassurance to adolescents. As well, you'll see that many of these apps use pink and red as their themes. And so what these apps don't do is appeal to menstruators who may not identify with being female. And so it was really important for me to consider that on building this app. In addition, no other app out there is designed to identify heavy menstrual bleeding in adolescents, and no other app out there can incorporate the aMBQ because it's brand new. So there were a few things that were needed. And so I set out to create an app to incorporate the aMBQ and thought, wouldn't it be great if the app could be something that an adolescent can use, whether it's on their first period or on subsequent periods, to answer the question, is my period normal? Because we all know what a difficult question that is to answer. And so the goal of this app primarily is to help adolescents answer that question. Secondary goals are to assist clinicians in identifying heavy menstrual bleeding in their office, to measure the impact of heavy menstrual bleeding on quality of life before and after treatment. And then I also wanted the app to have the ability to serve as a data collection tool to further understand the measurement properties of the aMBQ and to further research this population. And so welcome to WeThrive. And so I am going to give a demonstration of the app and sort of walk you through how to use it. Before I start that though, I'm wondering if there's any questions that have come up so far.
No, we don't have any questions, but if somebody does have one, please put it in and we'll be happy to share it.
Great. Thanks, Christine. So I will and carry on and I'll show you the app. So WeThrive was funded by the Care Until Cure grant from the Canadian Hemophilia Society. It was built over a period of 11 months by a local developer in Halifax who worked closely with Dr. Price and I. We developed a prototype of the app that we showed to a focus group of adolescents to facilitate early end user feedback, incorporated that feedback, and then subsequently launched the app on November 10th. So it's just over 2 months old. And the focus group of menstruators that reviewed the prototype of the app all said that they preferred the app over paper surveys for menstrual tracking or for answering questions on the aMBQ. I'll show you that the app incorporates symptom tracking, and the adolescents in this group really liked that feature. They all said that they would probably use the aMBQ feature of the app sometime between 2 and 12 times a year. So some adolescents wanted to use the aMBQ during every period to see if each period was normal based on the aMBQ response. All of the users felt that WeThrive was user-friendly, visually appealing, and unique in its ability to identify heavy menstrual bleeding, and really emphasize that that should be the key takeaway of what makes WeThrive different. And so WeThrive was created by pediatricians, Dr. Price and myself. It's the only menstrual tracking app out there that I know of that was created exclusively by pediatricians with developers. It was specifically designed for teenagers. So although adults can use it, the aMBQ was only validated in adolescents, and the app itself is designed to be for teenagers. It's designed for anyone who menstruates, meant to appeal to anyone who menstruates regardless of their gender identity. It doesn't ask any questions about sex, gender identity, or sexual orientation or anything like that. WeThrive is free to download on Apple and Google stores and contains no advertising. There is no need to create a username and password to log in. And as I mentioned, it is the only app that can identify heavy periods. And so this is the main landing page of WeThrive once you download it and set it up, which I hope you all do tonight. As you can see, as soon as you open the app, it will give you a countdown till your next period so that you can be prepared. And this countdown is based on previously tracked periods. So it's really meant to be individualized and as accurate as possible for your own periods of menstrual bleeding. Then you can see the blue heart there is the touch point for logging symptoms, and then the yellow drop is the touch point for logging your period. You can see the 4 icons at the bottom. The one on the far left takes you back to this main page. This one, the second to the left, is a calendar where you can see your period tracking and the dates that you've had flow. The third one here is the opportunity for you to fill out the aMBQ, which I've called the flow check. And it's also the area where clinicians can go to view all of the period reports from previously tracked periods. And then the info button is a list of frequently asked questions about periods, as well as a list of clinics. And I'm going to show you all of these pages. At the top of the landing page, you can toggle between dates. So if you want to see how far away you'll be from your period a week from now, because you're planning a trip or something, you can do that here. And I think I went through, so from kind of left to right, you've got your period calendar, flow check, and the learning center. So this is what happens if you click the touch point for tracking your period flow. So this is based on the PBAC. So what a user is asked to do is to log their flow based on the number of pads, tampons, or menstrual cups used and the level of saturation. Another unique feature of this app is that not every menstrual tracking app has the menstrual cup tracking feature built in. So I'm happy to say that WeThrive is able to do that. And then basically, as you go about your day with your period, anytime you change a product, you can log your flow, or at the end of the day, you can tap how many products you went through that day, what they looked like, and there will be a tally at the top for the number of products that you've used. After you've completed your period, there's a little button that says, I've finished my period. It'll ask you, are you sure that you don't want to log any more flow? And if you say yes, WeThrive will automatically generate a period report for you, which has a summary of your period, including the average number of products used per day, when your next period could be expected to come. And the score at the top is the score on the PBAC. And so a score of 100 or more indicates heavy periods. A score of less than 100 indicates likely normal periods. And if you have gone a month without tracking a period, or you haven't finished tracking your period, you can opt into push notifications for the app to remind you to do so. This is the period calendar page where you can see, based on previously tracked periods, when your next periods can be anticipated to occur. You can see here that the brighter the orange, the more likely it is that you're going to have bleeding on that day. And there's this window of prediction. And so the lighter orange are less likely to bleed that day, and the darker orange are more likely. No app is perfect, and probably the hardest part about designing this feature is to generate accurate prediction. So we built this in so that there would be sort of a window of when you could expect your period, with the most likely bleeding day, that darker orange day. And again, this is based on previously tracked periods, and the more periods you track, the more accurate your period prediction will be. This is the symptom tracker. And so if you want to track symptoms related to your period, you can track pain, you can track how you're feeling or your emotional changes during your period, and any changes in your body like bloating or acne. And you can do this anytime, even if you're not having menstrual bleeding on that day. If you want to use the app as a symptom diary, you can absolutely do that too. That little tab next to the calendar is the period health report page. And so this is important for users as well as for clinicians. So for users, this is where you can decide to go and complete the Adolescent Menstrual Bleeding Questionnaire, the aMBQ. But so that it's a little bit more catchy, for the app, we called it the flow check. So the flow check really asks you the questions of the aMBQ to help determine how much your bleeding is affecting your quality of life. And that will also give you a score to see whether or not you may have heavy menstrual bleeding. This period summary page also offers you a summary of all your previous period reports. So here it says March 10th with the little drop. You can click on there and view period reports from previously logged periods. It will also give you an average of the products that you use per period and per day. So if you're shopping for your next period, you have an idea how many products you might need. If you are to complete the flow check, you'll see a series of 25 questions. It takes about 10 minutes to complete the flow check, and ideally you would complete it all at once. This is just one of the examples of the questions on the flow check, like the average number of days missed from school. Most of the questions address the impact of your period on quality of life. So how many days do you think your schoolwork suffered because you were bleeding, for example? And what I want to mention is that for some adolescents, they may not want to track their period at all. So they may not be interested in the PBAC or the menstrual tracking features. But that doesn't mean that we can't help them identify heavy menstrual bleeding. So that's what this flow check is for. So if you have an adolescent who's really hesitant to track their period and doesn't want to do that, you can fill out the flow check to have an idea of whether or not your periods are heavy. And so WeThrive offers identification of heavy menstrual periods by two means, one by tracking and one by completing the flow check. I will say it's of course the most helpful to do them both because more information is always better. But I understand that there's a group of teenagers that probably don't want to be tracking their period, and I wanted there to be an option for them. This is especially true when we consider trans populations, so trans female to male patients who may still be menstruating, but it can be quite a trigger for their gender dysphoria to think about tracking their menstrual period. So that's a population of patients that I would advocate for the flow check. So the flow check will give you a score. A score of 30 or more indicates possible heavy periods. And so that's really the aMBQ score. So based on our study that showed that the score over 30 had a pretty good discriminatory ability to pick out those with heavy bleeding. And when you log into the app, you will be presented with a page that says you can help others. And that's a simplified consent form that asks you whether or not it would be okay for researchers to collect your anonymous data about your menstrual tracking and your responses on the flow check for research purposes. So what that means is that if you consent to research, I would be able to log into my research portal and see the results that you have put into the menstrual tracker and the flow check, but I would have no idea to know that it's you or where the responses are coming from. I wouldn't even know like your birthday or anything like that. I would only see the scores, and I'm going to use that information to further study heavy menstrual bleeding. And then, so what happens if the app does identify heavy menstrual bleeding? So what happens if you have a score of 100 or more on the tracking or of 30 or more on the flow check? The app is going to prompt you to connect to your healthcare provider. And so if you are connected to a family doctor or you're connected to a bleeding disorders clinic, then that would be a great avenue to go. But we know that there's a number of Canadians that aren't connected to a clinic. And so what I did is provide a list of clinics that are walk-in clinics in every province in Canada. I did my best to keep this list up to date, but there's also a hyperlink to a website that regularly keeps the lists of clinics in every province up to date that's accessible through the app, because I don't want teenagers to feel like, oh, I have heavy menstrual bleeding, now what? So I wanted there to be an option for them to connect to a healthcare provider. In addition, I have generated a list of frequently asked questions based on questions that I get from patients or questions that have been submitted to me. And I've updated this based on evidence that's cited in every answer. Things like symptoms of bleeding disorders in women or menstruators, how to know if a period is heavy. I've even attempted to provide some tips and guidance for how to talk to a healthcare provider about heavy periods. And I encourage users to submit their own questions to me so that I can enter them on the app. So I can go in and update this FAQ anytime. And so if you have a burning question about periods and you want to confidentially ask that, you can submit it to me and I will put it on the app, and it doesn't have to connect with your name or anything like that. I was going to get into a little bit about what it was like to build an app, because some researchers reached out to me to ask me to talk about that a bit. But I was hoping to pause there and see if anybody had any questions about WeThrive and how to use it.
We don't have any questions logged yet, but I have one.
Sure.
So being a member of the bleeding disorders community, if I had a daughter, I would be watching and waiting. So when a young woman starts her menstrual cycle, at what point would it be good to have her use the app? My understanding is that it's not a regular menstrual cycle in the first little while. So do you recommend like to wait a little bit, or what do you recommend?
Yeah, that's a great question. So I will preface this by saying that I haven't studied the aMBQ in patients with bleeding disorders on their first period. In fact, the participants in that study had to have had at least 2 menstrual cycles prior to participating in the study. But I would encourage anybody to use the app even on their first period, because I think the PBAC could be really helpful there. The PBAC has been validated in that population and can still recognize heavy menstrual bleeding. And I still think it's helpful to do the flow check, because we're shifting towards the definition of heavy menstrual bleeding being any bleeding that affects quality of life. And so even if this is an adolescent's first period, if it's enough for them to be missing school and sports and affecting their quality of life, I would want to see that patient. We know that periods that are heavy at menarche may not always be heavy. We know that the first 2 to 3 years after menarche, periods can be really irregular or heavier than normal. And the most common cause for that is an ovulatory dysfunction. So just not having regular cycles and an egg released each month. But having an ovulatory cycles doesn't exclude the possibility of a bleeding disorder. So especially if you're the mom of a patient or in a family with a known inherited bleeding disorder, I think all the more reason to use the app and reach out to your healthcare provider. So I will say that, heavy periods, even at menarche, still deserve investigation for an underlying cause.
And we have a question from the attendees. How do you suggest approaching a conversation with a family doctor if the app identifies heavy menstrual bleeding for a teen? Should you bring up the app results and the doctor will recognize the scores easily?
Yeah, that's a great question. I actually I'll go a little bit forward. My hope with my work with knowledge translation and getting the information about WeThrive out there, one of the major groups that I'm targeting are primary care providers, so family physician and nurse practitioner, because you're right, ultimately, those are probably going to be the first line, the people that are going to be diagnosing this the most. And so one thing that I've done is made this graphic that's what clinicians need to know about WeThrive. And this is available in the app. And so if you go to frequently asked questions, it will say, how do I talk to my healthcare provider about this? If you click on that, it will give a summary of what's on this graphic. So here's the parts of the app that your healthcare provider needs to know. And if they don't know about it, here's the paper that they can read to help learn about it. And so in a way, I'm kind of saying that even if your family isn't as well researched in heavy menstrual bleeding as I am, I suppose, that shouldn't limit their ability to diagnose heavy menstrual bleeding. And I think part of this is empowering users and empowering patients to feel that they can have objective evidence that what they're experiencing is not normal and bring that forward. Because we know that some of the delays in diagnosing bleeding disorders, especially in women or in menstruators, are a lack of recognition from healthcare providers. So I'm really hoping that WeThrive is like a tool that we can use to say, I'm having heavy bleeding and let me prove it to you because look at this. And so I hope that answers your question.
I have another question for you. So women who have heavy menstrual cycles with bleed and they have an inherited bleeding disorders often pass large clots. And I'm wondering how that, and a lot of people will double up the protection that they use. They might use pads and tampons. So those clots interfere with the absorption of the products. And so I'm just wondering how it accounts for, because you're changing all the time, but you might not have actually soaked the whole tampon because of that clot.
Great question. So the PBAC actually does count clots as well. And you do get either, I would have to look, but either more points or just as many points for a clot as you would for a heavily saturated product. And so in that way, we're not missing menstruators who pass clots. And it may not have shown up on the graphic here, but on the app, you can actually track clots as well. And it defines clot as, a blob of tissue that's usually red or brown, just because in my experience, teenagers don't always know what we mean by clot. And think that that's normal. So we have a definition of clot and a way to track clots because they are incorporated into the PBAC.
Okay, I just wanted to mention, Dr. Pike, if you don't mind, that especially for the healthcare professionals that are joining us, that on our website here in Manitoba, on our website, hemophiliamb.ca, we have a women's health section. And in there's a pipeline to care. And if you go there, you can actually see the process to refer to the Manitoba Bleeding Disorders Program. Now, I recognize that every province has different ways that they take referrals to their bleeding disorders program, but in Manitoba, that's where you would find that you refer to Cancer Care Manitoba and all the information that you would need there.
Christine, if I may make a comment on your first question about, when to use, is it appropriate to use WeThrive on your first period? And so I just wanted to endorse what Dr. Pike said, as well as obviously, one of the risk factors, one of the questions we ask in taking a history in a young woman who may present with heavy periods in terms of trying to figure out, could this be due to a bleeding disorder, is really, answering the question, have you had heavy periods since you started to have your periods? And so I think, although as Dr. Pike pointed out, we didn't validate this with the first period or onset of periods, I think it's really a helpful tool actually to be able to have objective evidence to take to a healthcare provider and say, yes, I don't just think my periods are heavy. I have objective evidence because I've tracked my periods for 3 months or over a period of 6 months, and these are my scores. So I think that will be helpful evidence to provide, as well as for the menstruators, helpful for themselves to be able to actually see over time if their flow has changed, increased, decreased, stayed the same. And that obviously can be tracked a number of ways, including be helpful in figuring out how much product they're using each time. Is that going up and down? So all this to say is, yes, it's true, we didn't validate this from the first period for this exact reason that they can be irregular from the start, but I think it still is a helpful tool to gather evidence to be able to provide the healthcare provider as well as the menstruator.
Absolutely, thank you. I will, I'm just being aware of the time because I know we want to keep it well within the hour. I may skip this part about the research related items, but I will say if there's any researchers in the audience that are interested in creating an app like this or any app for adolescents, please contact me. I've learned a lot by trial by fire, and so I'm happy to share that experience with you. And I think I just want to end with a plug for our social media campaigns. And so I have tried to appeal to adolescents in the best way I know how, which is through TikTok and Twitter and Instagram and Facebook. And so I would love it if you could all, shoot me a follow, give me some likes, share with your friends, whatever they say. And Also, if you're interested, if you have ideas for material to post, if you would like to post about your experience, reach out to me, because I'm really looking to enrich this content and I want to make it helpful for users. So if there's questions about periods that you think would be helpful to have on here, or questions about bleeding disorders, don't be shy. Let me know. This is really meant to be for you. And so this is the handle for WeThrive app. So please like and follow and share with everyone you know, would be great. And I'll just end with this slide. I just wanted to show the 2 fact sheets that I circulated for Christine, and I'm happy for this to be widely disseminated as a link with the YouTube video or on your website or whatever you like. Just things that you need to know about WeThrive that I went over in this talk, and things that clinicians need to know about how to use WeThrive to better serve their patients. And so to summarize then, we know that heavy menstrual bleeding has significant impact on quality of life in adolescents. This app, WeThrive, incorporates the PBAC and the aMBQ to help identify adolescents with heavy menstrual bleeding. These apps can benefit users and researchers. It wasn't an easy process to get here, that's for sure, but it's all worth it in the end. And we are excited about using social media as a tool to engage youth and to increase the awareness about how heavy menstrual bleeding affects teens. And I just wanted to say a big thank you to Canadian Hemophilia Society, who believed enough in this project to fund it. And without it, it would not have been possible. I'm happy to share that we have over 200 downloads already, which is really exciting. I really want to give a big thank you to Vicki Price, Dr. Price, for supporting me through the whole project. And she always believed in my ideas, no matter how crazy they were or that they seemed. Red Space was our local developer that we worked so closely with, and some really valuable team members there. A shout out to my stepdad, Brad, who helped me with all the digital media on a pro bono basis. And a big shout out to menstruators everywhere, because this is really who this is for. And that's all. So yeah, happy to hear any comments or take any questions.